In simple term, diabetes is excess urine, which is classic symptom when the sugar goes up. Mellitus is because the urine is sweet. Sweet urine is diabetes mellitus, or what we call as madhumeha. Meha is urine, madhu is sweet. Madhumeha, diabetes mellitus. Okay. And how we diagnose? Of course, high sugar. Next. So fasting sugar has to be above 125. Next. 2 hours sugar after taking a 75 gram glucose load. This is a standardized test that has to be about 200, or HbA1c, which is your average sugar over previous 3 months, has to be above 6.5. If any of this comes into your report, you are diagnosed as having diabetes mellitus. Okay, basic. This is diabetes. Next. Wait. So what are the types? What do you know?
Type 1, type 2.
Okay. What else?
Gestational type.
Okay. Anything that caused a lot of high sugars during COVID? So drugs. Not only steroids, lot of drugs cause high sugars. Remdesivir was only for 4-5 days. But if you know, some cholesterol medicines, some hypertensive medicines can also cause sugar to go up. Okay. So yes, type 1. Type 1 is very rare. Usually it presents before age of 10, and it is caused by destruction of your pancreas that produces insulin. So there are antibodies. There is no natural insulin. The only treatment is taking insulin. But these patients are less than 5% of total number of diabetic patients. Then type 2, which forms almost 90% of total diabetics, where there is insulin. In fact, there is excess insulin. There is no insulin deficit. But that insulin is unable to work. That is called as insulin resistance. Okay. Next. Gestational is there is no diabetes before pregnancy, but the lady shows high sugar during pregnancy. Once the baby is out, the sugar normalizes. That is gestational. Okay. Then drug induced, we spoke about. And then there are other rare types that we won't talk about today. Okay, now what causes type 2 diabetes?
Stress.
Okay. Okay. So
Lifestyle in the food.
Sorry?
Lifestyle.
Lifestyle. So multiple factors, right? Next. So what causes type 2 diabetes? Basic is insulin resistance. What is it? Insulin cannot work. There is insulin, but how insulin works naturally is that insulin has to go to certain cells, say liver cells or muscle cells. It has to attach to certain receptor that opens gates for glucose to go into the cell. There is some defect in that receptor insulin connection, and that's why the gate doesn't open. Sugar cannot go into the cells. That's why blood sugar remains high, but actually your cells are not getting sugar. Okay, so that is type 2 diabetes. This is very closely related to amount of visceral fat content. What is visceral fat content? What is viscera?
Excretion, what we pass on.
So, no, viscera is organs in the abdomen, inside chest and abdomen. You can come. Okay, so that is viscera. So how does viscera look like in normal person and a diabetic person? Next. So left side is how liver should normally look. Right side is fatty liver. Now lot of you must have done ultrasound once in a while. Lot of reports say there is fatty liver grade 1, grade 2, grade 3. So this is how actually the liver looks if you open abdomen, when there is excess visceral fat. Next. Left side is healthy heart. Right side you can see a lot of fat, that yellow thing. It's all fat. This is visceral fat. And this fat, it is metabolically active. Okay. It doesn't allow insulin to work. So how are we going to reverse diabetes? We have to remove this fat. Okay. Now this fat is increased by multiple factors that you told me. Your lifestyle, stress, no control on diet or whatever. But ultimately it has to result into increase in visceral fat. So we were discussing certain thing before the meeting started, and somebody told me there is a lot of sugar in Goan food. That's why Goa has a very large number of diabetes. It's not directly true. If you are having excess sugar which is resulting in excess fat, then you will get diabetes. But if you are having a lot of sugar but you are maintaining otherwise healthy lifestyle and your visceral fat is low, you won't get it. Okay. Next. Okay. So now we know that type 2 diabetes is caused by insulin resistance, right? Can you detect it before the sugar goes up? Actually, this type 2 diabetes, the process starts about 5-6 years before the sugar actually goes up. So if we can pick it up at that level and start doing something about it, then we can postpone or prevent diabetes completely. So somebody said yes. How do you detect it?
Blood test.
How?
Glucose tolerance.
No, your sugar is normal. Glucose tolerance test is normal. But
Excess urine.
no, we are talking about a stage where your sugars are normal, but you have insulin resistance, which is a precursor for developing diabetes later. How do we detect it? Next. So there are some skin changes. I am going to show you some photos, and there is a test called HOMA-IR. Okay, just see that. What is HOMA-IR? Basically, it relates your sugar, fasting sugar to fasting insulin level. Okay, so in simple terms, I will tell you what it is. By example, suppose I have two cars. One car goes 100 kilometer, the other car also goes 100 kilometer. Now, which gives me better fuel economy?
One which uses lesser fuel.
So you need to know the fuel. Without that, you cannot determine whether it is economy good or no. So with that sugar, unless you know how much insulin is needed to maintain that sugar, you will not know what is the economy of that insulin. So that is what this test finds out. My sugar is 100, but how much insulin I need to keep it 100? So I recently tested mine. I don't have diabetes. So I needed insulin of 2.7. It is in micro units, 2.7 to maintain the sugar of 100. Now one of my patients who recently did his reversal, he needs 19 of insulin to maintain 100 level. So for same sugar level, he needs much more insulin, and that is insulin resistance. What body does? Insulin is not working, produce more insulin. Okay, next. So if you do this test, it is easily available in most of the labs. If it is above 2, there is insulin resistance. So next time, if you don't have diabetes, but if you are overweight, if you have excess belly fat, check fasting sugar and fasting insulin level, and then calculate the index. You will know whether you have insulin resistance or no. Next. So these are typical skin changes. This is neck of a person. This can come on neck or armpits. Small tags, can you see? This tells me that there is more than excess insulin in body. These are skin tags. So a lot of time patient comes to me for something else, say toe pain or something else. But if I find it here, I have to tell him, get your insulin level checked, probably you are resistant. Next. This is neck of another person. The neck skin becomes thick. Once you have seen this, probably tomorrow you go in crowd, you will start looking at these things. Some people may even go home, see in the mirror, can I see this? Okay, but these are important signs. Okay, next. Okay. So what all medications do diabetic patients take? No, one is diabetic medication. What else do they take? Okay. So list is so big, even we get terrified to write their prescriptions. We'll go through that one by one. So medicine to control sugar, obviously needed, correct? Next, medicine to control cholesterol. Once you are diabetic, one atorvastatin, rosuvastatin will come by default, because type 2 diabetes is not only sugar, it is also about cholesterol. It's not only sugar. Next, then usually BP has also crept in. They will need BP medicine. Now, two common BP medicines, they also cause sugar to go up. So again, you are going to need bit more of sugar medicines. Next, then usually the uric acid is also slightly high. So uric acid medicine. Next, then kidney starts getting affected. So medicine to protect the kidney. Okay, next. Then doctor says, okay, you have to prevent heart attack, paralytic attacks, which are common in diabetes. Blood thinning, aspirin, clopidogrel, whatever. So blood thinners. Then diabetes causes constipation. So this is another medicine. Another medicine is there. Next. Then they have to come. Multivitamin, calcium, omega-3, arthritis medicines, all these come. Now what all these medicines are going to cause to your stomach? Acidity. So acidity medicine. This is typical prescription of a diabetic patient who has diabetes for about 10 years. Very common. And usually they will not be on one medicine to control sugar. They will be on 2-3 medicines. So you will see a list of maybe 12-13 medicines in single prescription. And I don't know, after eating so many medicines, how they eat food also. Difficult. Okay. So what do all these, next? What do all these medicines do? What they do to your diabetes? Next. Next. They just prevent or treat the complications that arise out of diabetes. But what do they do to the diabetes itself? They don't do anything. Of course, all these medicines are needed because we want to survive longer. And diabetes, the sugar, cholesterol, if not controlled, we are going to die earlier. So those medicines are needed. But there are no medicines to reverse the process of type 2 diabetes. No medicine. Next. So how do we reverse diabetes? Now I think you know the answer. Reduce the visceral fat. How do you reduce the visceral fat? Exercise. Okay. Okay. Any easier but bit more risky way to reduce fat? Liposuction doesn't work, but he is on right track. There is a surgery called bariatric surgery. It's official treatment to reverse diabetes mellitus. Cost around 5 lakhs plus about 10 days in hospital. Still you have to do diet lifelong. Otherwise you lose 25-30 kilos of weight. It comes back within 2 years if you don't maintain diet. So diet is anyway needed, whether you do surgery or no. Okay. Next. Now every disease, including infections, they have some non-modifiable risk factors, some are modifiable. Okay. So non-modifiable risk factors for your diabetes are, one is age. As you age, the risk increases. But we don't see many new diabetics above age of 75. So probably after 75, the risk is not that much. New diabetes. Age, genetics, you cannot change your genes. Okay. And then there are modifiable risk factors where we can do something about it. Diet and physical activity. Okay. Next. Okay, what does it mean to reverse diabetes? What is diabetes reversal? Anyone? What do you mean? My diabetes is reversed means what?
Controlling without medication.
Yes, your sugars are normal. Fasting is 100, post meal is less than 140 and A1C is 5.7 without need of medication by definition for 1 year. Then I can officially write on paper, this patient is free of diabetes. Okay. So that is called as diabetes reversal or technically diabetes remission. Okay, but what does it mean? So what was the age of development of this type 2 diabetes about three decades ago? Any idea? It was a disease of elderly, above 60 years. Okay, what it is now? We commonly see 25-year-olds. 25. I have seen 35-year-old patient with 10 years of diabetes going on dialysis. Yes, it is very, very common. So that is what has happened. So we cannot completely eliminate diabetes from earth, not possible. But by remission, what we are trying to do is a disease that has become disease of young people, we are trying to make it into disease of elderly. The main reason is if I get diabetes today, the complications are going to start after 10 to 15 years. If I get diabetes of age of 30 years, at age of 45 years, my children will be in 10th standard or something. If I get a heart attack, paralytic attack, whatever, then the whole family is gone. But if I get diabetes at age of say 70 years, at age of 85 years, I'll get all complications, which is anyway, I think, good life. So I'm ready to die, something like that. Okay, next. So this is what we are trying to achieve. We are trying to push the diabetes back to 65 or 70 years. So does it mean that those like people who are here already have diabetes, who are above age of 50 years, should they try to reverse or no? Yes, they must try. I mean, our first batch, we had a lady who was 65-year-old. She came off medicines completely within 6 months. 6 months, no? Yeah, 6 months. So she is off medicines, A1C is well maintained. Next. So these are seemingly simple steps to reverse diabetes. First is achieve optimal body weight. Don't try to go into body mass index. It is a bit complicated formula. You just need to know your height in centimeters. Minus 100 for males, minus 105 for females. Like I am 171 centimeters. I need to maintain 71 kilos. That is my ideal body weight. Okay. If I am a female, my weight has to be 66. So before we started our own diabetes reversal batches, my weight was 75 kilos. And now I am at 65. So I am a bit underweight now. I am trying to increase. It is not only about weight, because our enemy is inside. So we have to reduce waist circumference. So what is the optimal waist circumference? Waist is measured at level of navel, not your trousers, navel. Less than 90 for males, less than 80 for females. Anyone knows their size? I am a bit underweight, but still my size is 88, so just borderline. So I am still work in progress. Okay. And then these days, most of the gymnasiums will have body composition machines that can measure your fat, muscles, water content. So if you have access to such a machine, then for males, the body fat has to be less than 20%. For females, it has to be less than 30%. So good weight, good body circumference, waist circumference, and optimal body fat content. Anybody goes to gym here? Have you measured yours? Okay, you need to measure. We get a lot of patients. In fact, last month I had 2 patients who were actually underweight. We checked their body composition. The body fat was 25%, males. There is a concept called thin fat Indian. The people look thin, but there is a lot of fat accumulation in the belly, inside. And this is our genetics, Asian genetics, where when we eat excess, all the fat collects inside rather than visible outside. Okay. So next. So how do we lose weight or fat without surgery? This you should answer, all of you. Lifestyle. So physical activity. What else? Food. Okay. So yes, correct. Simplest. Who said eat less? Perfect. So 5 steps. 5 simple this thing. First is diet. Next. Second is also diet. Again diet. Fourth, diet. And last is exercise. Now why exercise is last and small letters and why diet is highlighted? When you are trying to reverse diabetes, how we reverse is weight loss. And for weight loss, diet constitutes 80% of the whole process. And exercise just helps to maintain your muscle mass. Okay. That's why when you are in weight loss mode, your diet is far more important. Once you are trying to gain weight or gain muscles, then exercise going to gymnasium, resistance training, that becomes more important. So diet, 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 diet. So do you need special food for diabetes? No? Okay, so we'll come to that. Next. First is you must know your food thoroughly. Now we read a lot of things, but we don't really read about food. Like when we go to internet and see nutritional value of rice, do we read that? No, we read accidents and political things and wars, but we don't check nutritional values. We need to check. So basically to lose weight, you need to create caloric deficit. Caloric deficit. Basically you should be eating less than what you burn. Okay? And out of those calories, that distribution is also important. 40% calories, they have to come from carbs, 40% from fat and 20 from protein. Typical Indian diet, I have calculated for myself, if I don't keep attention to my diet, my carbohydrate goes to 65 to 70 straight with low fat, low protein. So you have to pay even those who eat non-veg, I am a vegetarian, but those who eat non-veg, they find it difficult to come below 50 unless you pay attention. This is very important. So first is caloric deficit, second is how you distribute these calories. A lot of time patients come or their relatives come, they say the patient doesn't eat on time. It doesn't matter to me. Timing is not important. You eat whenever you want, no issues. But you maintain your caloric goal and maintain your breakup with day-to-day food. Okay, next. So do we really know our food?
No.
Yeah, even I am learning. Okay, so I am going to show you some examples how our diet with day-to-day food can be changed for correct balance. Next. Okay, so most of the patients I get for the first time, they said once I was diagnosed with diabetes, I have stopped rice. Now is it a correct thing to do or not a correct thing to do? Why it is not a correct thing to do?
For our climate it is required.
Yeah, for our climate, but scientific reason?
Because it has got carbohydrates on it.
But wheat has also got carbohydrates.
Wheat also is bad. It is bad.
But we need energy, no? So we need carbs. We need 40% coming from carbs. Okay, so we'll see the reason. Next. So we are going to compare chapati, rice and pav. Typical 3 items. If you take a 50-gram chapati, it gives you 130 calories. We are trying to cut calories, right? Next. If you have pav of 60 gram, pav, usual your 5 rupee pav is 60 gram, 150 calories. Next. Cooked rice, how many calories? 65.
Staple diet.
This is why rice may be actually better. So now you have to remember that the weights are quite close to each other, 50, 60, 50 gram. So we are talking about same weight of food, weight of cooked rice. Yes. So you need not stop rice basically. You have to watch your quantity. Now why 50 gram of chapati gives 130 and 50 gram of rice gives 65?
What's this?
Gluten, no, gluten is not an issue here at all. No, glycemic index is same. In fact, rice is slightly higher.
Maybe digested first.
No. Okay, how do you prepare rice at home? Ladies, gents, whoever prepares?
Starch is out.
For chapati we may be putting little oil.
No, see. When you have cooked rice, 50 gram, out of that only 15 gram is actual rice, remaining is water, which has gone inside the shell. So when you are having 50 gram of rice, 2/3 is water that you are having. It gives same fullness, but actually you are eating less. Okay. That's why if you eat same amount of 3 different things, rice is much better. Okay. But now we have seen rice is good. Does it mean all rice preparations are good? No. So let's see that. Next. So there are 3 items that I have chosen, 100 gram of each. Okay. First is steamed rice that we have seen. 100 gram was 50 gram was 65, so 100 gram 130 calories. 92% comes from carb. We want how much? 40%. So this is very carb heavy. Next, idli, 100 gram, extra calories, lesser. Next, 77% carb, protein has slightly gone up, fat has slightly gone up. Why? There is dal in it and there is less water in it, more of substance. Okay, next. Now you have puffed rice chivda, it is still rice. But you eat 100 gram, it gives how many calories? 473. And then the carb is lesser, fat is a lot. So chivda. So it's not on oil plus all is substance. There is no water in chivda. All has evaporated. So it's not only important what you're eating, how you are prepared is equally important. Next. Okay, now we are going to see the difference in certain things. Okay, next. So I have, suppose someone is having breakfast. So I have compared 3 different things, mix and match things for breakfast. How slight change in your daily diet makes big differences. Okay. So suppose I have 2 chapatis and 1 cup of cabbage bhaji. What does it give me? 360 calories. 65% comes from carbs. Protein is just 9%. Fat is 26%. So this is not what we want, right? Next. So I decide to change it slightly. I have only 1 chapati, but I have 200 gram of usal, not your cabbage. Usal has good amount of protein. So I have reduced the calories, 260. I have reduced the carb. The protein has nicely gone up to 19%. And fat is slightly lesser. So this gives me slightly better food for my breakfast. But I am not happy with this also. I want to improve it further. How can I do it? Next. So I have 1 chapati, only 100 gram of masoor usal. Next. With 1 boiled egg. What it does? Calories are still same. Carbs have gone down 48%. This is much closer to what we want, 40%. Fat is 30% and protein is 22. So just changing from 2 chapati and 1 bhaji to 1 chapati and usal and 1 chapati, some usal and some boiled egg, I have changed my diet drastically. I have not done anything special. Okay, next.
But fats have gone up now a lot.
Our goal is to keep 40% fat. So we are in our goal. Okay, next. Okay, so this is another example of how we look at dal rice. Okay, so suppose I have 1 cup of dal and 100 gram of white rice. It gives 173 calories. Okay, with lot of carbs. Next, I am not happy, so I take 2 cups of dal and I reduce rice. Now calories are almost same, lesser carbs, more protein. Next, I think dal is very, very good. So I eat only dal. Is that possible? No, practically possible. I can eat dal. So 3 cups of dal, 164 calories, 45 carbs, very good. Protein 18%, very good. Fat 37%, very good. So shall I eat only dal? Shall I eat or no?
You can.
Okay, the answer is no. What is the reason?
You can't actually eat that much.
You can increase the dal and reduce the chapati.
No.
There is no chapati.
No. Here what I am saying is, you eliminate rice or chapati completely, have only dal.
You are achieving your percentage.
You can actually.
Practically you can do, but there is one problem. What are protein? No. What are protein made of? Dal has a lot of carbs, no issues. What are protein made of? This is where study about food comes in. What are protein made of? They are made of amino acids, smaller. Now almost all vegetarian proteins lack 2 specific amino acids. They are called essential amino acids. So if I eat only dal, I am not going to get those 2 amino acids. and see how our ancient diet works. Those two missing amino acids are there in rice. So you have to mix rice and dal. And there is one amino acid which is missing in rice is present in dal. So when you mix these two things, you get all amino acids. Okay, and this is why we have to study our food. Just because I have adequate protein doesn't mean that it is good quality protein. Vegetarian source good quality protein is milk and soya bean. All other are incomplete proteins. Non-veg items all are good quality protein. Okay, next.
Sir, you are telling about breakfast only.
No, this is, so what do you want to know?
So lunch, fish, we are going to eat fish.
Yeah,
So is it good or not?
it is good. All non-veg food is good in protein quantity and quality. They are very good.
Going further than one chapati.
Yeah. No, that's why this is a very short session. No, so I can take only a few examples. So, okay. Now this is another thing, lot of patients ask me whether I can have chocolate. Chocolate. Okay. Wait. So suppose you have diabetes, will you eat chocolate? Will you not eat chocolate?
I am diabetic. I don't eat
Now why don't you eat chocolate?
because of the sweetness, sugar.
And what if you eat dark chocolate?
More sugar in it.
No. Anything else?
But our dark chocolate has sugar, is right partially.
Okay. Now we are going to see that. See, there are two parts of this. One is you are trying to prevent sugar spike.
Yeah.
And second part is you are trying to reduce your weight. That is reversal. Okay, so we'll see how chocolate compares, different chocolates. Next. So this is standard Cadbury dairy milk, 100 grams. How many calories it gives? 524 calories. Okay. Out of that, 43% is carb, protein is 5, 52% fat. Okay. Next. 85% dark chocolate. Next. Only 15% carbs. 8% protein and fat is 77. Yes. So how it works is, if you eat dark chocolate, it will not cause spike in sugar, which is a good thing if your sugars are not well controlled. But if you are trying to lose weight, whether you eat dairy milk or 85% dark chocolate, it is almost same, 524, 543. So what is important is how much you eat. See, human eats because he likes the food. So we need not stop eating certain things, we have to watch how much we are eating. You can eat chocolate daily, no issues. How much you eat is important. And because you are eating chocolate, you are eating certain calories, then you have to compensate it by eating something else in lesser quantity. Okay. So I have taken very few examples. So what we have discussed today is what is diabetes, what is type 2 diabetes, what causes type 2 diabetes, which is fat. How to reverse is reduce your visceral fat, and how to reduce visceral fat is diet and exercise. And in diet, unless we know what we are eating, unless we study our food, we won't know what we are doing. So it is extremely important to study food, and this has to start actually right from maybe 5th or 6th standard in schools.
Yeah.
Okay. So that is the end of today's session. I hope you learned something new. So now there are two things I put. One is reversal, the other is prevention. So when do we do prevention? If you have signs of insulin resistance, you have to prevent it. If you have diabetes, you have to reverse it. Process is exact same. Lose weight, lose fat. Simple. Okay. So here is a live example. He has diabetes since many years, but he has managed to lose how many kilos? 8-10 kilos, and he is off medicines. So